Hi there, my name is Jim McMorran. I'm a GP from Coventry, a Cancer Research UK GP and Editor-in-Chief of GP Notebook. Today I'm doing the second part of my videos regarding PSA and prostate cancer, and we're looking at the limitations and practicalities of using PSA in primary care. So PSA is used in the diagnosis of possible prostate cancer, but further investigations are required in order to confirm that diagnosis. However, PSA can be increased for various reasons. Getting older, benign prostatic enlargement, prostatitis or a urinary tract infection can all lead to increased levels of PSA. PSA levels can be reduced though by medications we use in primary care, so 5-alpha reductase inhibitors such as finasteride or eusteride can cause reductions in PSA levels. Also, medications such as statins, aspirin and thiazide diuretics can all cause reductions in PSA. Obesity can cause reductions in PSA, and this is difficult because obesity is a risk factor for the development of prostate cancer, and so this makes the use of PSA difficult in obese men. I need to tell you a bit more about the 5-alpha reductase inhibitors and PSA and prostate cancer, because the use of a 5-alpha reductase inhibitor causes a 50% or more reduction in PSA. 5-alpha reductase inhibitors have been used in trials to look at whether there is a reduction in risk of prostate cancer, and the prostate cancer prevention trial used finasteride and showed a 24% reduction in prostate cancer. However, there was an increase in the prevalence of higher grade prostate cancer in the finasteride group. The study authors suggested that the increased number of high grade prostate cancers was perhaps also due to the increased sensitivity of PSA in this cohort and identifying patients with this disease. The learning point from this study is that PSA in patients on a 5-alpha reductase inhibitor is more sensitive for prostate cancer than those not on these sorts of medications. So a raised level in somebody on finasteride or eusteride is more suggestive of possible prostate cancer than if they were not on these medications. So what about the practicalities of taking a PSA test? Are there any times when the test needs to be delayed? Well, if somebody's had a prostate biopsy, then there needs to be a period of 6 weeks before you do a PSA level. If you've had a digital rectal examination, then there needs to be a week before you can do a PSA. If a man has had any prostatic stimulation or had been a recipient of anal sex, then there needs to be a week from that event before checking a PSA. If somebody has undertaken vigorous exercise, then that requires 48 hours before checking a PSA. If a man has ejaculated, then that requires a 48-hour period before checking a PSA. But what about urinary tract infections and prostatitis? Well, in acute prostatitis, there is evidence that 70% or more men will have an associated increase in PSA. And if somebody's got a proven urinary tract infection, evidence suggests that only about just over 50% of men will have their PSA return to normal after a period of 4 weeks. A BMJ article looking at this suggests that if somebody has a normal digital rectal examination and evidence of an infection of the urinary tract, then there should be an 8-week period before retesting an MSU to prove no infection and then doing a PSA. So what do the guidelines say about checking PSA in primary care? So NICE suggests that GP should consider doing a digital rectal examination and a PSA if a man has urgency, frequency or hesitancy or nocturia. Also, they should consider a digital rectal examination and PSA if somebody has urinary retention or erectile dysfunction or visible hematuria. The NICE guidance suggests that a 2-week referral should be made if there is a raised PSA in the age-specific range. Now, when NICE produced the guidance in 2015, the ranges were for men 50 to 59 greater than 3, 60 to 69 greater than 4, and over 70 greater than 5. In 2016 though, the Public Health England changed the guidance for age-specific ranges and suggested that men aged 50 to 69 with a PSA greater than 3 should be candidates for an urgent referral. However, the 2016 age-specific ranges have not been widely adopted. Thank you then for watching this second video of PSA and relating to PSA and prostate cancer. I hope that you've found both informative and hope that you will come and see further videos on GP Notebook TV.